All righty.
We're ready to go? Excellent. Oh, good. I got to grab my socks twice. Okay. So my name's Mel. So I'm a hand therapist, and this is Sophie. She's with marketing. She's here to help out. So I apologize because I had other notes, but my computer crashed. We were just talking about technology. So I'm going to be working off my sheet here. So I guess we can start off and we'll just talk a little bit about kind of what hand therapy is. So hand therapy treats everything from the wrist, hand up to the shoulder. So it's a certified position. Oh, we got one more. Come on in.
Welcome.
Hi there.
Go ahead and take a seat.
Okay. We're just getting started. Oh. Okay.
Bye.
So as anybody here, have you all had hand therapy before or had some kind of therapy on your body for something? Okay. So hand therapy as a discipline is the one crossover between physical therapy and occupational therapy. So either PTs or OTs can be hand therapists. To be a certified hand therapist, you have to have 3 years of experience before you can even sit the exam, and a number of thousands, about 4,000 documented hours of training again. So it's a very specialized, it's considered an advanced practice. And again, it shares physical therapy and occupational therapy. So if you go to a hand therapist, they may or may not be a CHT yet. They may be a PT, they may be an OT. The way that it splits by percentage, about 85% are OT, and the rest of the percentage is made up by PTs. So there's less than 6,300 worldwide CHTs, which is why they're kind of hard to find if you're looking specifically for somebody that's sat that test. So, but lots of hand therapists never sat the test because they've been doing it forever and they don't want to, or they have test anxiety and they don't want to take it. There's a lot of reasons that they might not take it. But that's sort of how that breakdown works. Any questions about kind of that part of the process? Usually you'll find them in physical therapy clinics, although there are definitely standalone hand therapy clinics where that's all you have is just hand and you don't have, like this clinic has everything. So, yeah. Okay. So osteoarthritis, rheumatoid arthritis, of course, those are two very different things. But we treat a lot of different diagnoses. So everything from acute traumas, tendon ruptures, burns, we'll treat arthritis, sprains, strains, and then some other chronic, genetic conditions. We treat all of those things. So again, from the shoulder all the way down to the fingertip, which is a fairly complex anatomy. So it's a great job, though. I do love what I do. So in terms of the continuum of care, when we're talking about arthritis, so there is everything on the conservative end, which is the things people do themselves first, all the way through what we do. So conservative treatment, meaning coming to therapy, getting ergonomics, education, and treatment. And then sort of in the middle of the continuum, there's injections, cortisone injections, those types of things. Stem cell injections becoming more popular. We're seeing more of them. They're still the minority, but we still see them. And then surgery, of course, is on the far end of invasive. So any questions about any of that? Okay. And I'm going to go through too. I've got a lot of ideas up here, things for you to come and look at, hold, and different things that work as treatments, things that work as ergonomic helps. And so all of those things are up here. And of course, there's a lot more. But these are some of my I've cherry picked what I like the best, just for information. All right, so obviously with something like osteoarthritis, there's a lot of factors. There can be a use factor, so just mechanical use over time. You're doing a repetitive motion and it upsets the joint. There can be a familial history that contributes. It can be something like rheumatoid arthritis, which is an immune-based arthritis that also causes pain and joint dysfunction. So there's a lot of different sort of presentations of it, but all of these things can help. Rheumatoid arthritis just tends to behave a little bit differently in terms of how it behaves with heat. So, for example, if I'm treating somebody with osteoarthritis versus rheumatoid arthritis, I will be less likely to use heat on somebody with RA because I don't want to kick off a huge inflammation cycle. It can make them more sore. But it really kind of depends. And like you all have experienced with medicine, I can tell you what the textbook says for osteoarthritis, but your experience of it is going to be very different. So the textbook for osteoarthritis says no cold. Cold makes it worse. But I've had just as many patients that say, I love cool. It feels good. Then you should use that. So it's not that cut and dry. We have some guidelines that we use. We have some diagnosis and information that we understand, but that doesn't mean that that's necessarily what's right for you. Any questions or comments?
I think I've got osteoarthritis. My joints the last year or so, I've noticed, and the warmth feels wonderful.
Yeah, that makes sense. That makes sense. Yep, that's a very common presentation. That sort of sore in the morning when you first wake up, and then if you take a shower or you move a little bit, starts to feel better. That's very indicative of osteoarthritis.
I'm using a Tylenol arthritis every once in a while.
Does that help
I do
you?
it all the time, but osteoarthritis, I guess used to be pain formula or whatever. It seems to help too.
Good. I'm glad you found something that works for you. Yeah. Yep. Everybody's there's and so this is a good sort of segue into the other treatments. So lots of creams out there, lots of topical things that people use. Voltaren is really popular. There used to be one, I haven't seen it as much, but there was one, what was it called? Blue Emu? Anybody remember that one? That one was real popular for a while. That was kind of a favorite there for a few years, and then it kind of went away. I don't see as much of it anymore. MSM creams, people talk about using CBD creams. I mean, everybody sort of has their own thing that they do, but for
Aspirin cream has one out too.
that makes sense.
On my wrist. I hurt my wrist some time ago, and so I've been coming here for, exercise and trying to get it back normal again. But that aspirin cream seems to help too.
Good. Yeah.
So I guess, what do you try?
Yep, kind of dealer's choice there. So on that note, I know I talked a little bit about it, but so we do a lot of what hand therapy does. I'd say the bulk of what we do outside of our treatment choices for you as an individual really has to do with ergonomics and understanding the mechanics of the hand. This is a very complex thing down here. It is levers and pulleys, controlled by muscles. It is many joints, many tendons, many ligaments. It's just very complex anatomically. So it's a lot of ergonomics and a lot of education, and then all of the treatments and things that we provide. So but it really is, I'd say by and large, that's what we do is help people with the ergonomic aspect so that you know better how to do the things that you want to do with less pain. I try to tell people all the time to think of your hands, especially as a bank account. Use them on what you want to use them on, but don't spend them unwisely. So try to avoid things like those mechanical can openers. Those repetitive motions are just not worth using your joint on. Use your joints for the things you want to. You want to hold your grandchildren, you want to knit, you want to do whatever it is, you want to woodwork, whatever your hobbies are, use them for those things and take care of them the rest of the time, and use the tools that we give you. And I'll go over some of those today, basic stretches and things that you can do that help. So, all right. All right, so on that note, when we're talking about ergonomics, so the sweet spot for the human hand, and of course there's a bell curve for this, right? But right smack in the middle, it's about 1.5 inches is the sweet spot for the human hand. So anything further as you come in, you're gonna cost your joints more. And especially as we get older, the smaller it is, the harder it is on our joints. So if you can build up your handles, if you can buy things with larger handles, that will save you. It'll go a long way. And things like knitting needles and crochet hooks have come a long way. They now have arthritis friendly sections. You can buy those things. I use those when I crochet. I don't even mess around with it because I know it's going to be a repetitive motion I'm going to do
Right, yeah.
for a long time. So I just use them.
I crochet and knit both. And I spin my own yarn too.
Very nice.
So,
That's
but I haven't been able to do that because, spinning, you have to have, your both fit your hands.
Yeah.
And so this has been kind of out of joint, so.
sorry about that. Yes, I know I tell people there's at least, so I'm a musician and so my hands take a beating. But there is about 3 or 4 days out of I'd say every 6 months where I just do not vacuum. It's not that bad. I just ask my husband to do it. But I just know better. It hurts. And when it hurts like that, I respect the pain.
Right.
That's the thing about osteoarthritis is that if you push through it with so much, we're all good at doing that. If you push through, you can make the inflammation worse. And so the cycle continues. So there needs to be some recognition that, okay, it hurts because that joint is upset right now and there's no reason for me to make it worse. Obviously, if there's things that you can't help but do, you just have to do what you have to do. All of us have those things that are not avoidable. But if there are things that you can put off until it stops hurting and you can do all the things, put on a glove, all of the things that you need to use a cream, that's just a smart way to do it. Yes, your hands are worth it. Walking is important, but you probably want to do something once you get where you're going. And you need your hands for that. So again, so the sweet spot's about 1.5 inches, and you'll see that if you go into a store and purchase almost anything that's arthritis friendly, everything is going to have about that size handle. So we will go through some of these things. Any questions or comments from anybody virtually?
Not
No,
yet.
nothing yet? Okay.
Yeah, can you get arthritis in your hips and knees? And
Sure
stuff
can.
like
Oh,
that?
yes.
Yes,
I work.
fortunately.
Oh, do you?
Yep, you sure can.
Okay.
Yep, it can kind of settle wherever it feels like it. All right, so something to think about, a couple of things, energy conservation. So thinking about what we've already talked about, if you have arthritis, the things that you do that aggravate your hands, knowing to take a break. It's just important. I can't sit down and play my guitar for hours anymore. I just can't.
Right.
Same thing, cello, I can't do it. It hurts, so I play until I feel kind of stiff and then I stop.
Yeah.
And that applies to everything you do. You just have to learn how to conserve your energy and use your hands more wisely.
Do you find like the Volcaren and things like that, if you're going to play, do you grease up in advance?
I do.
Okay,
For me, if I'm going to play, especially like cello, something that really puts a stretch on me, I'm going to put it on beforehand.
I find
Yep.
Volcaren or Bengay or something, if I put it on in advance, it helps warm things up and get it moving so that I.
Yep. Yeah, I do for sure. I would rather preventatively treat something than have to deal with the crisis that comes afterwards. So that's my opinion. I know that there's a lot of people that don't necessarily want to medicate for whatever reason prior to, but certainly that is an option. So stretching, taking breaks, those ergonomic adjustments that you can make, things like using bigger muscle groups. So rather than choosing to lift things, with your fingers, if you can get underneath something with your whole hand, you're going to activate your biceps. You're going to be using a different muscle group, and that helps. It's just a nice ergonomic shift in how you do things. And some of these tools here help with that. So we'll go over those things. I think I'd be remiss if I didn't at least mention diet because it is important. There is anti-inflammatory diets, omega-3s are important. All of those things count. So when you're thinking about what you're eating, and you can talk with a registered dietitian if you have questions about what that looks like. There's a few here in town, one in Anacortes that's very, very good. And it's worth, if you've never spoken with a registered dietitian and you're here today, probably a good call. If you want information on how diet can help you, because it certainly does, has a huge impact. Okay, so creams we talked about, larger joints. So outcomes, you know, with hand therapy, like I said, a lot of times if somebody comes in and they have osteoarthritis and I'm going to treat, it's probably going to be 6 weeks. It's probably going to be a couple of times for 6 weeks. As long as there's nothing really major going on, right? As long as it's just your sort of garden variety arthritis, then we're going to be able to give you everything that you need within that time frame, most likely. Sometimes it goes a little bit longer, but most likely we should be giving you the tools that you need, and you should be walking out of here not necessarily not better. We can't put cartilage back in the joint, but you should know. I know, we wish we could too. But you should know, you should have a whole toolkit by the time you leave a hand therapist's office, knowing how to go about, you know, a good period of time without needing us. I always joke that therapy has a recidivism rate because we do see people come back. And places like IRG that offer injury screens are excellent, because that means if you come to therapy, you do 6 weeks of therapy, and 3 years later, you feel like it's really gotten worse, you can just come on in and we can look at you again and help you decide, is this actually something I just need a tool for that I don't have yet? Or is this something that I need to come back in for? So those things make it very accessible. And Medicare still, at this point, covers a lot of hand therapy. So, yeah, so you'll have, you know, like with Medicare, there might be a limited number, but you could check with your insurance too about that. But certainly, the efficacy of the treatment is there, or the federal government would not pay for it. So, any questions about any of that? Okay. So what else I got? I don't think. And no questions online still?
Not yet, no.
Perfect. All right. So let's go over some of the tools that we have here. I'm sure everybody has seen or used at least one of these, but some of them are really neat. And also, I put this on the handout. I don't know if it made it to the updated version of the handout. But as your grip deteriorates, don't forget that they make transfer poles. I just put one on my porch for my parents. They love that thing. It goes floor to ceiling. I installed it myself. It has a little handle. And it's just something that they can use to hold on to as they're moving one step. So grip, of course, is associated with falls in all the research. So it's something to think about. I'd rather do it sooner than later. Now my parents are in their mid-80s, so they definitely need it. But it is something to think about. They can go in bathrooms, they can go on porches, and they are aftermarket, so they come down. They don't screw in, you know, they will come down. Those are great. I got it from Home Depot. So it's just something to think about as your grip changes. Please don't forget that hands and falls have a lot to do with one another. Okay, so we already spoke about this just a little bit before you came in, but the compression gloves, arthritis gloves. And so I'll just ask them to be another one.
You want to show the camera as well?
Should like those.
Yeah.
Oh, thanks.
Those are like sailing and cycling gloves.
Yes.
Yeah,
Yes.
Yeah,
And on that note, that's a really good point that I actually didn't put in my presentation. And that is that the cycling gloves that have the anti-vibration pads, those can be really helpful if you've got nerve stuff going on. So just to help cushion just a little bit,
oh, yeah.
you know, with those median nerve upsets.
It feels, it makes my hand feel comfortable or something, you know, it's just.
That makes sense, yeah.
Thing.
Yeah, it feels pretty good. I feel kind of protected that way.
We do have a question online.
Yes.
Anne asked, she said, I have had a finger splint made 8 months ago at IRG for wearing at night. They're getting loose and fall off easily. Do they have to be remade or can they get crimped by the hand therapist?
Yeah, so I don't know exactly which one you have, Anne, but certainly you could drop into a clinic and ask a hand therapist if you have one near you, or call and ask them that question. A lot of the things that we make custom, we can fix in very, very short order. So, and I'm glad that you brought that up because, yeah, custom splinting, and we'll get to that in just a moment, but custom splinting is something else that we do too. Did that answer your question?
Yeah, she said, thank you. That's helpful.
You're welcome. You're welcome. Okay, so the compression gloves are a go-to for us. These are, and these you can purchase over the counter, but we do a lot of thermoplastic custom splints.
Oh.
So it depends on the person and what their work is, what their needs are, as to whether or not we do something over the counter. The nice thing about over the counter is that this is mass manufactured. It has a little bit like this is a push meta grip, and I'll pass this around so you can see this. But these ones have an aluminum band in them, so it is somewhat customizable. So I can squeeze it and make it smaller, or I can expand it and make it bigger. And this is for thumb arthritis specifically.
What do you think of the hand things that have copper in them?
And we were just talking about that. So I don't have a preference.
Oh,
I think it just depends on what feels good to you.
oh, okay.
So I've had as many people say copper doesn't do anything for me, and other people say I really like it. I like the copper fit gloves myself just because of the texture and the fabric that they use.
And it seems
So-
like it makes it warmer or something. That might be my imagination,
But it might not be. Yeah.
It just feels, when I have the one on that's infused with that copper, it just seems like there's a warmth or something.
That makes sense. Yeah. And I think it's really important that you do those things, and that if that feels good to you, then you use those.
Do it. Yeah.
Yep, that makes sense. Okay, so these push meta grips, so they are right left specific. So as I was saying, the advantage of them is that they're mass produced. That's the upside. The downside is that they're mass produced. So these, fit like this. It straps on. The point of these is basically to diffuse the load of the CMC joint, which is down here. This is typically where we see arthritis have a first seat in the hands. Yeah. And so right here, so this just supports that thumb joint just enough so that you still do all the things that you would normally do, but it helps diffuse the load. So the thumb isn't getting into a weird position. I always tell my patients, this is not meant to be something that you are heavily reliant on all the time. We still want to do strengthening, and strengthening objectively gets better with hand therapy after about 2 weeks of doing the exercises. We see an objective increase in strength and a subjective decrease in pain. And those metrics make me very happy. That's about as good as you could hope for. So, but this is meant to, you put this on, like, that you're going to go do something. So you put this on to save your joint from what we were talking about earlier, where you've done something chronically, you've moved things and your hand's now really sore. So this is meant to help with that. And then still exercises and stretches. So these are great. And for those of you who are online, if you have one of these Metagrips, if you purchase one of these, you'll need to size yourself for it or have a hand therapist size you for it. But the one reminder I always give people, it's like I said, if I squish this thing, it changes shape. And so what happens a lot of times, patients come back and see me and say, it doesn't fit anymore. I had it in my bag when I was traveling. Yes, you did. And you put 50 things on top of it and now it doesn't fit you right. But it goes back to its original shape. So let's pass that one around. And they come in different sizes, but that's probably my favorite off the shelf. There's a few other brands and they're all good. But again, it's sort of like the compression gloves. It's what fits you best. And I certainly have had some patients who absolutely cannot wear those. It does not fit them. It doesn't matter what I do to it. Nope. it just doesn't fit the hand quite right. Especially, you know, larger handed folks, those are harder to fit on sometimes, but it's just, we always try them. And then it kind of depends on what you're doing and what your needs are. So custom splinting, so we have lots of options for custom splinting. It's something that most of us hand therapists love doing. It's art and physics. It's a nice combination.
You got it.
Yes, and very strong Velcro.
Then where does it go?
So the straps go on the back side of your hand. So you got to flip that thing over.
Anybody? Oh, I see what they mean. Yeah.
So let's put this on the other way. Hold on. We got it on upside down. That's why it doesn't feel quite right. There you go.
It's like saddling a horse.
Yeah, a little bit like an English saddle. A little less Western, a little more English. So again, depending on your needs, you know, custom sometimes is just better, especially for my folks that are, you know, construction workers. People that really are abusing their hands, they need something a little bit stronger. And sometimes custom will do that. Custom has its own drawbacks as well, but it's nice that we have so many options. And we have all kinds of different materials. We have just regular thermoplastic, and we melt it in about 150 degree, 130 degree water. And then we mold it to you. So that's nice because it really is custom. The downside of those is that we put the straps on them. So it's, you know, Velcro over time tends to give out. But either way, there's just a lot of different materials. We also have material that is a textile that has a thermoplastic woven into it. So it's very soft and very light. So there's all these different options. It's a really fun part of my job, actually. Okay. So let's talk about the one exercise that I wish everybody would stop doing if they have arthritis, especially in your thumb. And that is everybody goes out immediately and buys one of those little squish balls. And you'll see people, you know, with these, like these are memory foam, these are different densities of foam. And everybody immediately runs to this idea that they need to just move it more. And that is not a great idea. And the reason why is because if any of you were ever runners or you're still runners, you know that if you go out and you move and your knee continually makes the same arc over and over and over again, eventually you got to hyperflex and you got to extend. Like you need to get that joints in full motion. And so a repetitive arc of motion is actually just not very nice. And if you've got arthritis, you probably will upset it by doing that. It's much better to run through things that actually require different planes, different positions, but just a repetitive squeeze is not necessarily a helpful exercise. So I wish we could just get rid of that idea, but I understand why people would fall to that, you know, as a go-to. Well, I just need to move it more. I'm not saying you should hold still either. Motion is lotion. It's really important. You got to move. But moving repetitively over and over again mindlessly is a really bad, it's a bad idea. That won't necessarily make you feel better. Okay. So I'm going to point out a couple of really fun things here. So a carabiner for carrying groceries is a great idea. This company, this is Click and Carry, and they make this neat handle. I'll pass this around. So this has a squishy side that you hold on to with your fingers. And then this is nice and ergonomic. And what you do is you just turn this and you just put your bags here and then close it. So your grocery bags, and then you carry it like a handle. You can use one of the big, like the Black Diamond carabiners. These are much cheaper. Those carabiners are very expensive. But you can just use a big carabiner. And if you went on Amazon, you could see a whole bunch of them that are specific for not just arthritis, but, you know, moms with diaper bags. I mean, when you're carrying multiple things and you need to put them all in one place, just makes it easier. So again, you just squishy on the bottom and you just push it open. stick your little bags in there and then close it. So for building up handles, they make all kinds of different sizes. I'll help you. They make all kinds of different, it's a little twist.
Okay.
Well, it's okay, you've never seen one before, so. So they make all kinds of different sizes of things that people add to, like in skilled nursing, I have used these, added them to toothbrushes.
Yeah, it does. Once you figure it out. Yeah, I was
Twist the top bit, there you go. So these people, I've added them to pens, pencils, toothbrushes, spatulas, pick a thing. In the home, just to build up the handle on your own.
Yeah, I'm a left-hander. And so it's been rather an interesting thing to try to write.
I'm sure, yep. And that's one of the things on this list here, is these little pencil grips. Those are excellent, just to build up the pencil just a little bit.
This is one of the gripping.
It is, yeah. I have also many times gone to Home Depot and bought pipe insulation. Works just fine. But of course, just to make sure I put this out there, make sure if you're putting on something that's dangerous, like a knife, you're not, please be careful. Please be careful.
Yeah, those crochet and knitting tools, the crochet hooks now come with the
Yep,
enlarged.
they do.
It's really nice.
It is really nice. Okay. This is one of my favorite inventions ever. This is, there's many different companies that make this, but it's basically, it was originally called a handy bar. So in your vehicle, on the actual door post, when you open your car, there's the little metal latch where the door latch is closed. This goes into that metal loop, and it allows people to push themselves up out of a car. So it reduces the strain on the hand, it reduces, it's nice and squishy, and it gives you just an extra point of stability. These things are fantastic. I love these.
Yeah, my daughter-in-law gave my husband something like this. It also had a thing on it that you could smash the glass.
Yep.
And
What it looks like.
Yeah, it's got all the things.
I haven't done that, but these are really neat. And it did help him out a lot getting in the car.
Yeah, it helps a lot, especially if you have somebody who's transferring but it's just another one of those tools when your grip is compromised, that it's a nice thing that you can use.
This is a seatbelt cutter.
Yeah, that one has a cutter.
A couple people online asked if you could show those
Yeah.
items up close if you.
Well, I will get one back here in just a moment. Thank you. Okay. So I don't know, am I close enough? Can you see?
Yes.
Okay. So here it is. That's about how thick it is.
Added this car.
And this is for getting out.
And this is for getting in and out of a vehicle. So this metal bit here just goes right into the loop. It's kind of it's a loop on the side of your door frame where your door latches. And this goes right down in there, and it is not going anywhere. You just pull it right out when you're done. So you just slip it in. So that is that.
Not the seatbelt.
Not this week.
Many different brands.
The door itself has a little D-ring that it grabs hold of, and this goes in that D-ring.
Yep.
I've got one in the car I can show you. It's really cool.
We could do a field trip out to the car if you want. Sophie would have to manage the.
I know I can do it.
So we already talked about can openers. Seriously, I really just like those. So these automatic can openers are so fantastic. Just put it on the can and hit the button. Just don't, especially that CMC joint. Just don't use this. They're $9. Just buy one. Be done with
Now,
it.
where do you get those?
So you can get these at Walmart. You can get them at CVS. You can get them online. Just set it on the can. It cuts off the lid nice and soft too. It no sharp edges, which is nice. My father is using one of these because he has dementia and he can use a can opener, but I don't want him using sharp things. So this is excellent for that.
What are we doing?
Cool.
We have it.
Okay, see what else we got. So lots of different ideas for opening jars.
I've got one of those.
Yep, these things,
Yeah.
this thing here, that, you know, just like a silicone, a grip pad. Pass these around. Anything that takes the load off of your joints.
Yeah. I've got one of those. It's absolutely fantastic. I got it through Amazon.
Yep.
And it comes with another little
It
piece.
came with this one.
Yeah.
Yep. This one's for bottles and things. Okay, so also got, I really like these. This is actually a jar opener for a mount. It mounts underneath your cabinet. And you put the jar in this way and then you just twist. So for some folks, though, I mean, even something like this is not quite usable. These are nice. I think if you've got both hands and both, you know, you can use both hands. Those ones tend to be harder. Because you've got to have the strength in one hand to still do it. I mean, you get leverage, right? You're out at the end of the lever, so this helps, but not necessarily like, you know, this one, you can have both hands. Similar to the handy bar, this is just an attachment that you can put on almost anything, but I would caution with these, depending on what you're using it for, really look at your load bearing. So you want a handle somewhere. Let's just say you need a handle somewhere for you to hold on to. Just be careful with these ones that come with command strips. So unless it's very, very strong and you know what it's rated for weight wise. But they make a lot of these extra little ergonomic handles and things. Guess everybody's probably seen one of these.
Oh, yeah. I've got one of those too. I love
They are great.
them.
They are really nice. Features, just for getting stuff.
There you go. Perfect.
Okay. So, and the other thing I didn't mention for the thumb is something that we do, as long as you're not allergic to adhesives. Kinesio tape or, you know, K-tape is a good way to help support the thumb also. So that's another treatment that we do. It's like a ribbon. You just wrap it around. It supports the CMC. And so obviously it's a lot less bulky. Although I think that those, like the push thumb splint that I showed you, is pretty low profile, but not as low profile as this. So it just kind of depends on what you need. But I've had a lot of people who are just, maybe they're moving just for the day. They don't necessarily need a splint, and sometimes tape is enough to help just a little bit. And of course, it depends on how advanced your arthritis is. So,
Which way do you put that on? Like
so
that?
we put it, yep. So if you hold your hand up this way, so we wrap it this way, and then it crosses over the CNC joint is where it, is where it crosses. Yeah,
Thank you.
you're welcome. My pleasure. Okay, I think I'm all my, I think I covered everything I had. So now we're just open for questions, if you have any. To talk to our online audience here too.
What exercises do you recommend?
Yeah, so we're gonna go over some stretches next. So we'll run through those together. I'm gonna. Question?
We do have a question online from Bill. He asked, what is the name of the tape for the thumb?
Hi, Bill. The name for the tape is Kinesio tape or K-tape. But if you go to any pharmacy, if you look for athletic tape, it's pretty much all the same. There's some people really have a favorite brand, but as far as I can tell, really the only difference is the adhesive. And that's so specific to what I do that I wouldn't ask you to pick a brand. Just pick an athletic tape. And then you could look up online, you can look up CMC thumb taping. You can, oh my gosh, there's 50 videos for every joint on how to tape. There's so many ways to tape. It just goes on forever. So, but go see a hand therapist if you need specific information about how to tape. We can certainly show you how to do that. Okay, anybody else?
Any other questions online?
No? Okay. All right, so I'm going to run you through my favorite stretching exercise for the hands. I do these, especially before I play an instrument. And I always remind people, similar to my comment about running, when your joint's doing the same thing over and over again. I do these because unless you are playing an instrument or doing pottery, you're probably using a fairly repetitive arc throughout your day. And so this is a good way to get all of the tendons to stretch about as far as they can go. It is not meant to be fast. Think of it like yoga for your fingers. So you're going to slow down, do the exercise, know that you've done it. More isn't necessarily better, but it's not going to hurt anything either. We just make a joke in hand therapy that this is how all of our patients find each other in the grocery store, because you should be just walking around, just going through these exercises. So we'll run it, and you may know these. So we'll run through these together. If you're wearing a splint like you are, it's going to be harder to do them. You can do them with a glove on. That's certainly possible. All right, so you're going to follow me. We're going to do them together. Pick a hand.
Take this off. Or
I'm going to use my right hand here. Okay, so you're going to start with fingers together. And just kind of in this rested, nothing's tense. All right, so you're going to bring down at the knuckles. You're going to bring your hands flat. Look at your fingers. So you should be kind of simultaneously pushing down and reaching for the wall with your fingertips. So your fingers should be flat and straight. And I am cheating because I do this all the time.
Please show the camera too.
Yes. So down and flat and straight. There you go. There's no muscle memory for this motion, by the way. Perfect. All right. From here, you're going to come up to a claw position. Pull the knuckles back. So your palm should be pushed out, like you're trying to draw the center of your palm out. So pull your knuckles, pull your fingers back. So you're pushing the palm open. There you go. It should almost be uncomfortable. Got some little tiny muscles in the hand. It is. It is uncomfortable. I should say that. This is not a comfortable pose. You got little teeny tiny muscles inside the hand, and this is stretching them quite a bit. Okay, so then from here, gently release and come down to a fist. No squeeze, just a gentle fist. Okay, then we're going to open up the fingers wide as they can go. And every finger and the thumb has their own tendons. So this part of the exercise, you're going to come over and touch the small finger and then open back up. So I want you to think about those tendons getting as close together as they can and then as far apart from each other as they can. And then all the fingers we're going to do one at a time. So small finger, ring finger, middle finger. And here's where everybody goes wrong with this exercise every single time at the table in front of me. This is what they do.
Oh.
And that's why I'm saying think of it like yoga. It's not speed. So it's touch and open and stretch. Touch and open and stretch. Touch and open and stretch. And especially with thumb arthritis, as your thumb starts to migrate in, this exercise is so nice to get that hand nice and open.
How many times do we do this?
So I run through these, like if I'm going to play something, I run through these just a couple of times. Just make sure I do it nice and slow. So yoga, tai chi for your hands. And if you do one side and then you compare it to how you feel on the other side, you should feel a difference. You should feel like you just stretched out.
Yeah, oh yeah.
Yep, it makes a huge difference. So let's do the left side or whichever side you haven't done yet. So straight and together. Okay, flat and straight. So again, reaching for the wall, flat fingers. Again, no muscle memory for this. Okay, and then claw, push the palm out. Draw the center of your palm out. Like you're trying to touch your palm on something without touching your fingertips. It is not comfortable, not even for me. How you doing, Sophie?
Hanging in there.
Okay, and then down to a gentle fist, and then open wide, and then touch, open, touch, open, touch, open, touch, open. So during those activities that you're doing that upset your hands, like we're talking about crocheting, stop, every 30 minutes, 20 minutes and run through these. Just give yourself a nice stretch. Same thing if you're golfing, just run through them. Like you've got time between holes, you can stretch your hands. And on that note, things like golf, I've had a lot of people have custom clubs made so that they could continue to golf even when their arthritis was really profound. So those larger grips, they help for those sorts of sports, and that goes for anything. I always remind people, it doesn't matter if you're using a spatula or a shovel, make sure that the grip feels good to you and that you're not walking away from whatever it is you're doing feeling like you can't use your hands for 24 hours. That's not a good sign.
I've got a Duplo contracture. Is that a
Dupitrons?
good one?
Dupitrons?
Yeah.
Yeah. Yep.
Is that a good one for that?
It's okay.
Yeah.
Yeah, it's okay. Dupuytren's a complicated diagnosis. We treat it, as often as we can. A lot of post-op, mostly is what we do in night splinting. So, but it's definitely, it's a more complex diagnosis. Any other questions?
Yeah, I found that this hand was starting to get really tired after doing that.
After the exercises?
Didn't hunt.
Jeez.
After the exercises, it got tired?
Yeah.
Yeah.
Just now, I noticed this hand was getting really tired. Like, stop. Okay. So I'll stop.
Yeah, that makes sense. Yeah, and it's not an exercise that is, gonna put a whole lot of strain on you. There's a difference between moving and loading a joint. So when you're doing something like this, you're just moving the joints, you're lubricating the joints through motion. That's very different than grabbing and pulling or pushing or doing something that's loading the joint. But certainly if you feel tired or it's uncomfortable at all, you just scale it back a little bit.
Yeah, absolutely.
Yeah, but it's a really, really good exercise. Any other questions on the handouts that I've provided for people that are watching online? We have provided sort of an ergonomic accessory list of the things that I went over here today. We've also have two handouts that were done by the American Society of Hand Therapists. One is what is a hand therapist, and the other is on CFC arthritis. But just so you know, they have lots of patient handouts on their website for free. One of them is on Dupuytren's. So there's many different diagnoses. This organization is fantastic. They put out a lot of really good and relatively brief information. So, and for people online, I think we're going to provide the links to those handouts as well. So, okay. So unless there are questions, that's what I have. That's my spiel. Oh, thank you.
We do have a question online from Bill. Is vibration good for fingers with neurological damage?
So it's hard to know exactly when you say neurological damage what we're dealing with, if that's in general peripheral neuropathy from something like diabetes, or if that's a specific nerve issue. I would say just in general that vibration is not something that I would use on an angry nerve. But it's hard to know. It's hard to know better how to specifically answer your question without knowing exactly what we're dealing with. But as a very general term, I would say no, I wouldn't use vibration if you're having nerve issues. In fact, if you're using vibratory tools of any kind, sometimes that can set off a nerve problem. So, I mean, even biking, even just cycling, with the pressure on the ulnar nerve and the median nerve can cause issues. So I would say no.
And Mara P says, thank you so much for the hand stretching exercises.
You're so welcome. My pleasure.
Thank you so much.
You're welcome.
That D-ring. Okay. Thanks.
All right.
Any other questions online?
Yeah.
It was hard to get out of the car. Joe.
Oh,
Thank you very much.
you're so welcome. If you want to tour the little hand section here, you're welcome to do so. And then we have the raffle and we have some gifts for you.
Are you a therapist here?
I am
For hands or for everything?
for hand.
For hands? You sort of self-diagnosed your thumb osteoarthritis, didn't you?
Yeah, I'm figured out some things, so.
Okay. Let's grab. So you want to hand these out?
Yes.
So I've got gifts for you before you go.
I'm just gonna
great.
end the
I love gifts.